Good afternoon, and thank you for joining us today for the back to school edition of the Road to Reopening FLB Schools. My name is Rick Emmerich, Superintendent, and with me is Dr. Sean Wolfram, our Assistant Superintendent. As you may imagine, our administration and teachers are once again taking care of the final touches as we prepare to kick off the school year on August 31st. Although we were truly hoping for a start that was mostly free from addressing any challenges related to COVID-19, this will not be the case, and some of the mitigation measures we had in place last school year will continue to remain in place. Those who may be closely following the virus may know that the status of community spread in Erie County is currently high, and according to health officials, numbers are projected to escalate in the coming weeks. In terms of the zip code specifically making up our school district, we currently find ourselves in the moderate range, but the number of confirmed positive cases has continued to climb over the past 7-day reporting period. All this stated, things are developing quickly, and we want our community to know that today's presentation is our best attempt to provide an update, knowing that some of what we share today may change before the start of the school year. This could include mandates from the Pennsylvania Department of Education, the Pennsylvania Department of Health, or the Erie County Department of Health. If such mandates do come about, please know that the district will respond accordingly and keep our students and families up to date as we draw closer to the first day of school. As always, a common sense approach to the safety of our students, faculty, and staff, and our entire school community has remained our top priority. That stated, our hope for today's session is to cover a few important topics that will prepare for a smooth kickoff and keep our families in the know as to what they can expect upon our first day of school. First, we are pleased to announce that a majority of our students will be returning back to school for face-to-face instruction. We do, however, have some families and students who have selected to enroll in the FLB Cyber Academy or pursue other virtual options provided by the district. In any case, having this many students coming back to brick and mortar instruction is great news, and I am sure that we all agree that nothing is more effective than in-person, face-to-face instruction. Secondly, our pandemic team throughout the summer has kept a close eye out for any and all reopening guidance provided by the Pennsylvania Department of Education or the PA Department of Health. In mid-July, we did learn that neither PDE or the PADOH would be releasing guidance or recommendations for the start of the 2021-22 school year. Instead, they directed each school district in the Commonwealth to use the most recent guidance and recommendations that were provided by the CDC. As you may be aware, the CDC guidance recommends that schools prioritize layered COVID-19 prevention strategies to maintain in-person instruction safely. In other words, keep our kids in school. According to the CDC, such strategies should be geared to protect students, teachers, and school staff who are not fully vaccinated. In making local decisions, they recommend that schools focus on levels of community transmission, vaccination coverage, and local policies and regulations. Simply stated, the hope of the CDC is that school districts can evaluate the status of COVID-19 within their communities and reopen for in-person instruction. Last Thursday, our board of directors approved the required and updated health and safety plan for our district. As we move forward through today's presentation, we will be covering the details within the plan and provide insight as to the various mitigation measures our district will have in place. Dr. Wolfram.
Thank you, Mr. Emmerich. Given the CDC recommendations, what will our school community see and what can they expect when students arrive on day one? Given the CDC guidance, our district has designed a layered mitigation plan where more stringent measures may be implemented should the level of community spread increase within our school community. Most specifically, if our school district reaches the level of substantial. As Mr. Emmerich stated, it is important to note that the level of community spread in our district is currently moderate, according to the data provided by the PA School District Reopening Dashboard. Given we are experiencing a moderate level of transmission, the following are the initial measures we will have in place to begin the school year. As you may recall, our district screened each student each morning upon arrival to determine if they had a fever. We also did this at many of our after-school events. At the onset of the year, we will not be checking for fevers. However, this may be a measure that we reconsider if we hit the substantial level of community spread. Our daily time schedule, just to make sure that everyone is aware. At our high school and middle school, the student day, students can start to arrive at 7:35 in the morning. Their day will be completed at 2:20. At Robinson Elementary, students can begin to arrive at 8:35. Their day will be finished at 3:08. And at Waterford and Mill Village, student arrival at 8:45 and dismissal at 3:18. As we did last school year, the district will make an at-home health screening checklist available, and we ask that all parents complete this each day before you send your child to school. If your child has a fever or is not feeling well, please keep them at home. The hand sanitizing stations will continue to be available in convenient locations in common areas in each of our buildings. Signage will also be posted in the several locations, reminding everyone to practice good hand hygiene. As we all have become aware, hand hygiene is one of the most fundamental measures we can take to slow the spread of the virus. The water filling stations will remain in place through each school building. Again, this year, students will be encouraged to bring water bottles from home and to remain hydrated throughout the school day. Classrooms will be arranged to promote 3 feet of physical distancing to the greatest extent possible. Desks will be spaced apart and facing forward. Our staggered dismissal procedures for each building will continue to minimize student contact and reduce hallway congestion. Each classroom will be equipped with hand sanitizers as well as disinfecting wipes to ensure hands as well as work areas are clean before and after each class period. Breakfast and lunches will be provided here at the school for students. As you may expect, physical distancing will be practiced to the greatest extent feasible, and students may be eating in their classrooms as well as in the cafeterias with limited occupancy. Last year, our custodial staff did an incredible job implementing aggressive cleaning measures during the day and after school to ensure that we do our very best to sanitize each building. They will continue this strategy this school year, and we thank them in advance for working so hard to keep us sanitized and in school. In terms of facial coverings, the guidance provided by the CDC recommends but does not require that individuals wear a mask while indoors. Therefore, the district has elected to pursue a common sense approach that is based on the existing levels of community spread within our schools. This information is shared weekly by the Erie County Health Department and is specific to the zip codes making up our school district. That stated, students, faculty, staff, and guests will choose whether to wear a face mask when the transmission level within Erie County is low or moderate. Please note that the district does strongly encourage mask wearing when we are in those low or moderate ranges. Should the community spread within the zip codes making up our school district reach substantial or high, universal masking would be required indoors for all students, faculty, staff, and visitors. Universal masking requirements would be lifted when the level of community spread returns to moderate or low. In summary, the district has fully reviewed the CDC guidance and believes that during times when the risk of community spread is lower, that wearing of a face covering should be a personal decision left in the hands of individual faculty, staff, and the parents, guardians of our children. As everyone weighs this decision, we do, however, strongly recommend that they consult with their family doctor to assess the individual risk factors. Also, it's extremely important to understand that those wishing to wear a mask are strongly encouraged but not required to do so regardless of the level of community spread. Again, this is a decision best made by our families and their family doctors. Please note that masking will be required while students are riding the school bus, regardless of the level of community spread. This is a federal mandate and at this time is not left to the discretion of individual school districts. Regardless of the level of community spread, should this mandate be lifted by the federal government, the district may respond by an optional approach to masking on our buses. Again, this will be driven by the existing level of community spread within the zip codes making up our district. Working or sitting together in small groups is permissible. Such small group sessions would require 3 feet of physical distancing and should be limited to no more than 15 minutes. Face-to-face staff or parent meetings will be fine, but a virtual option can always be considered. Field trips will be offered, but students and staff must follow the COVID-19 protocols or policies of the establishment they are visiting. School visitors for instructional purposes will be permissible. Each visitor will be screened and required to wear a mask while on campus. In terms of ventilation in each of our buildings, we have adjusted all HVAC scheduling according to the COVID-19 ASHRAE standards, and each system will start up an extra 2 hours before school and 2 extra hours after school to get more fresh air in the buildings. Also, our team will be changing all HVAC filters every 3 months instead of 6 months to improve air quality. Each of those air filters will be rated at the highest recommended MERV value. Now back to Rick.
Thank you, Dr. Wolfram. So the question becomes, what if we hit substantial or high in terms of community spread within our school district? Should we hit the substantial level, the district may implement more stringent COVID-19 mitigation measures, depending on guidance or potential mandates provided by the governor, PA Department of Health, or Erie County Health Department. These may include the following. Again, requiring facial coverings or masking for all students while indoors. Screening of students for a fever when they arrive at school. This could include after school or extracurricular activities. Relocating some of our larger classes to spaces such as our LGIs, auditoriums, and cafeterias for instruction. Adjusting building level traffic patterns to reduce hallway congestion in between classes. And then suspending all field trips. So in February of 2021, the district developed the FLB Targeted School Closure Rubric and COVID-19 Tracker. A similar rubric outlining the school closure protocols will continue. However, we are in the process of updating this resource to our website in hopes of reflecting the current guidance. As of today, the recent recommendation provided by the Pennsylvania Department of Health outlines a maximum 14-day school closure to be considered when the following criteria is met. First, 5% of student staff are confirmed positive COVID-19 cases in a 14-day window. For a small school, which is a school less than 500 students and staff, reaches a caseload of 25. A medium school, 500 or 900 students and staff, the range of cases would be between 25 and 45. This would include our high school and middle school. Again, our elementary schools all are below the 500 range, so they would be considered a small school. Also found on our website document are the daily COVID-19 counts for each school building, the number of total cases each day within the zip codes which make up our school district, and a weekly update on the number of active cases within our school district. This will also be provided on September 1st. Additional updates are underway to the COVID-19 link on our district website. Given the fact that additional information and updated documents continue to roll in, these updates should be completed by the beginning of next week. So again, we should have our COVID-19 tracker updated by September 1st, and by the end of next week or the beginning of next week, we should have our COVID-19 links updated on our district website. As always, our pandemic team will continue to do our very best to update our sites each day with information as it becomes available to us. Contact tracing is a very big question, as well as quarantine. And in terms of both of those issues, contact tracing and quarantine, we have confirmed the following through the Erie County Health Department. If an individual is identified as a close contact, again, that definition remains 6 feet for less than a period of 15 minutes or greater. Close contacts will only be identified when contact tracing will be triggered only when a person is laboratory confirmed as a positive COVID-19 case. Again, let me reiterate that because that's an important point. Close contacts will only be identified and contact tracing will only be triggered when a person is laboratory confirmed as a positive COVID-19 case. At this time, the Erie County Health Department has been carrying out a majority of the efforts related to contact tracing. However, given the projections and the numbers that we anticipate in the coming weeks, the school district may once again be involved in identifying close contacts and conducting case investigations. Dr. Wolf.
In terms of quarantine requirements, please know that they will remain mandatory as a matter of public health laws in Pennsylvania. In other words, quarantine requirements, when issued to individuals, are a legal obligation. That stated, here are a few updates. Vaccinated students and staff will not have to quarantine so long as they are not symptomatic. Unvaccinated students and staff will not have to quarantine if they are appropriately masked while indoors. Unvaccinated students or staff who choose not to mask throughout the school day will be required to quarantine. Household contacts do not have to quarantine if they are vaccinated. If students become symptomatic, the district will continue to ask that they remain out of school, quarantine, and request that they immediately schedule COVID-19 testing. Unlike last year, siblings of a confirmed positive COVID-19 case, so long as they are not symptomatic, do not have to stay at home, but will be encouraged to mask until results come back. If the student is positive, siblings who are vaccinated will not need to quarantine so long as they are not symptomatic. If a student tests negative, the district encourages them to remain home until symptoms have subsided. Mr. Emmerich.
Just a few other important updates. The school district will be requiring, as we did last year with COVID-19 testing, as well as any antibody results, we will require proof of vaccination for all individuals identified as close contacts and they wish to become exempt from quarantine. Just a reminder, the quarantine period remains the same as last school year. Again, this is a period of 10 days, beginning 2 days prior to the most recent contact with the infected individual. There are some exemptions to that, and an individual can be tested after day 5 and exit quarantine at day 7 if they are negative in terms of a PCR COVID-19 test. As in all cases, individuals may return to school after day 10, so long as they are not symptomatic, and we do encourage folks to monitor their symptoms until that 14-day period has exhausted. Unlike last year, and this is a very important point, probable cases will no longer be treated as confirmed positive cases. Again, only contact tracing, isolation, and quarantine, all of those will be triggered by a laboratory-confirmed positive COVID-19 test. In addition, we will not be including probable cases in our building-level COVID-19 case counts. Well, this concludes today's episode of The Road to Reopening FLB Schools. We fully understand that this was a lot to take in. To review an outline of the information shared today or to submit questions about today's session, please visit the FLB School Community COVID-19 question form. Have a great day, and we look forward to seeing everyone soon.